recording. Well, we've commented on conditions A and condition B about signs and symptoms, and let us have a look at these conditions and decide which diseases the signs and symptoms might relate to. In condition A, you remember what is the disease? What kind of disease can it be? Any ideas?
Sinusitis.
Maybe fever.
Okay, yes, possible because of the raised temperature. Okay, and this is just headache, worsen bending. This is very important symptom of sinusitis, for example, as you said. Okay, and in condition B, what are possible diseases here?
Vomiting.
Vomiting.
Abdominal pain.
So, and what is the diagnosis?
Can be heart attack.
Heart attack,
Stomach flu.
diarrhea, and
Abdominal pain.
Stomach flu, ma'am.
mm,
Food poisoning.
okay, something connected with the like gastritis, for example. Poison.
Food poisoning.
Poisoning, yes. Okay, something wrong with the okay, yes, like here in the picture. Now let's go on and let us make a list of the signs and symptoms that we would expect to see in a patient with pneumonia. What kind of signs and symptoms can we see?
Cough.
High fever.
High fever.
Okay.
High fever.
Tiredness.
Affected to
Fever.
lungs.
Dehydration.
Breathlessness.
Okay.
Shivering.
Color when severe bluish color to nails.
Okay. So,
Heart rate.
Fast breathing.
Great. Okay. And which of them are signs and which of them are symptoms? So we speak about signs. Who can summarize the signs of the
Tiredness is
and the symptoms?
High fever is a symptom.
is bluish color to nails. Is symptom.
Okay.
Fever. Dehydration.
Dehydration is a symptom.
Sweating.
Okay, good. Thank you. So you'll be the great doctors. And if we move to the next slide, here we need to focus on some specific language that is used when doctors just talk to a patient. So they shouldn't use the technical language. You need to use non-technical language that the patient can understand easily. Let us look at the two example questions from the case history. Which verb means precipitate and which word means start in the first sentence? So when do attacks come on? So what is the meaning? start?
When did it start?
Yes.
When did it start?
And are you aware of anything that triggers the attacks?
Precipitate.
Yes, precipitate the attacks. So that comes before the attacks. Okay. So here, these are the examples of simple language and more complicated medical, technical language. Well, and here are, well, this is the exercise that we can practice using non-technical words. So we should replace the technical words which are given in italics in the sentences, like here, perform in the first sentence, with non-technical words from the list. The list of the words is given below, is given to the right, and you may need to change some of the words, some of the forms of the words, not all of them. So the words are avoid, admit, have got, thrown, do, to come and go, stick to book, there all the time. And now let us read the sentences and use non-technical word instead of one which is highlighted here. So let us listen to Labib.
Yes, ma'am.
The first sentence is for you, please. So there is a problem with connection. So, well, let us listen to another. No. So can the other students hear Labib?
No.
Sorry. So let's listen to Hepzibah.
Yes, ma'am. We are going to have to perform a few tests. We are going to do a few tests.
Exactly. Now, please, Ansila.
Yes, ma'am.
Mhm.
She is suffering from a very bad bout of flu. She is admitted.
Instead of suffering, what should we use?
She is admitted.
No. Can you think of another phrase to use here? She.
Wait. She.
Any ideas who can help us?
Have.
She has.
Have,
You
ma'am.
have got.
Has got. Yes, she has got a very bad bout of flu. Okay. So, and now Asna, please. The next sentence.
It might be a good idea to refrain from fatty foods for a while. Avoid.
To avoid fatty foods for a while. Great. So the next is Shamisha.
Yes, ma'am.
Read it, please. Number 4.
He is prone to many minorities.
Okay, instead of perceptible, we say prone here. So Ramisa.
Yes, ma'am.
Number 5, please.
You said the cough is intermittent. You said the cough is to come and go.
The cough comes and goes, right?
Intermittent, instead
need
of
S.
intermittent, use to come and go.
It's not to come. So we say, you said the cough comes and goes. This is present simple. That is why we use S at the end of the verbs. Okay, the next one is for Jan Parvin. Jan Parvin, are you here? No. Hala Malik? Yes, number
Hello.
6. 6.
Your cough is persistent. Does it come and go?
It's not just come and go, it should be persistent.
Is it stick to?
It doesn't disappear. It doesn't come and go. It's here.
Ma'am, does it stick to?
I should say, is your cough there all the time?
All time.
Okay. So, Sultan, the next sentence, please.
Yes, ma'am. It's difficult to adhere to any kind of life change.
Okay.
It is difficult to stick to any kind of life change.
Yes, right. Good, great. So the next is for Sinju.
Yes, ma'am. You won't have to be hospitalized. You won't have to be admitted.
Admitted. Yes. Sorry. And the last sentence is for Danish.
Yes, ma'am. You are scheduled to see the nurse in the allergy clinic next Tuesday. You are prone to see the nurse in the allergy clinic next Tuesday.
So scheduled here, scheduled. This is
or booked, ma'am.
Yes, booked. You are booked, to see.
Yes, ma'am.
Okay, good. So remember about this when you speak to your patients, that you should use a very simple and easy to understand language. And now we are coming to the task. We should just do. We should use the phrases which are given below to make questions with non-technical words. And we should take turns to role play a patient with a flu or a cough, and the conversation between the patient and the doctor. So there are some phrases for a doctor, just tips to how to start questions. We should start questions with when, is there, you see the beginnings, and there is an example. Example. The doctor should ask such kind of questions as, are you prone to something? Are you booked to see somebody? Do you find it difficult to stick to medication? Does your cough come and go? Have you ever had? So we are speaking about flu and yes, cough. They are connected anyway. So let us choose the person who will be a doctor and who will be a patient. Ashwati, are you here?
Yes, ma'am.
You'll be a doctor, okay? And Taib, are you with us, Taib? No, Taib. Minus. And Hepzibah, are you here?
Yes, ma'am.
So you are a patient. So please, Ashwati and Hepzibah, start please, the doctor. Start asking questions.
Yes, ma'am. Are you prone to any chills or fever?
Ma'am, so how I should reply yes or just yes or no? Is that enough?
You should answer the questions, yes?
Yes, it's sometimes yes, I am prone to chills and cough.
Okay. Are you booked to see some doctors?
Actually, the next question.
Are you booked to see? Are you booked to see a doctor?
Yes, I have booked to see a doctor.
Okay. Do you find it difficult to stick to the medications?
Sometimes I feel difficult to stick to the medications.
Okay. Does your cough come and go?
Yeah, it's frequent.
Have you ever had this before?
No, it's for the first time.
Okay. Thank you.
Thank you.
So can the doctors think of any other questions? Do you remember the Socrates model that doctors should follow in asking questions?
About the severity.
Yes, about the severity.
From 1 to 10.
Timing when it started,
Mhm, mhm,
whether
And
it
the
radiates to
history.
other places.
mhm. So give the patient a chance to answer. What is the question about severity?
It's rated about 1 to 10.
Getting
And-
worse in
Can you
morning.
please number it
Yes.
from 1 to 10?
Mhm.
Telling about the rate, it's about 6.
Mhm. Okay, so then what else? The other questions?
Does it follow time pattern?
Mhm.
Timing?
How often, yes, do you have this
Yeah.
condition? Mhm. So the
It's
patient,
Is there something that makes it?
Mhm. Can the patient answer this question?
Ma'am, I haven't heard the question. Can you please
Mhm.
repeat the question?
Is there something that worsens your cough?
Actually, I am allergic to aspirin.
Okay, so I mean that also you should also not forget about, shouldn't forget about this model when you ask questions. Mhm. I see, Labib is facing network issues. I see, thank you. Mhm. Well, let's go on to the next slide, and here we have just to listen to the last part of the conversation between Dr. Dixon and Mr. Bloomfield when he asked some questions about the general history. And you can see here several just topics. So they are speaking about appetite, bowels, waterworks, and sleeping, these things. And let us focus on the forms of the questions that the doctor focuses on, just how he just asks these questions. So I'm starting the I'll switch on the recording and you'll tell me if you hear.
Listening 3. Okay. Do you smoke?
So do you hear?
We can hear.
Yes, ma'am, we can hear.
Okay, good.
Listening 3. Okay. Do you smoke?
No,
You drink?
just socially. Maybe a couple of beers a week, nothing more than that.
Is your appetite okay?
Yes, I never seem to have any problems on that score.
Bowels okay?
Yes,
Waterworks okay?
yes,
Sleeping okay?
yes,
General health okay otherwise?
yes.
I think we'd better have a look at you. Could you just pop behind the screen and...
You see, when in the conversation, when doctor asks questions, they can be shortened, the forms of the questions. So what were the questions about these things? How did the doctor ask about appetite?
Is your appetite okay?
Okay.
Is your balls okay? Is your water box okay? Is your sleeping okay?
She was sleeping okay.
He just asked bowels okay, waterworks okay.
Waterworks okay?
Yes.
Sleeping okay?
Mhm.
Whatever okay, sleeping okay.
Yes, and he just raised the intonation at the end of the question just to show that this is not a sentence, this is not a statement, this is a question, right? Well, and
Listening 3.
Let us just look at these sentences, these questions, and we should expand these short questions, like it's given in the example, like you've been off work at all. The full form, the correct grammar form of the sentence of this question is have you been off work at all? So what about you eating well?
Are you
Eating well or
Are you eating well or have you been eating well?
yes, present perfect continuous. Have you been eating well? Your appetite okay?
is your
Is your
appetite
appetite okay?
Is your
Is your appetite okay?
You're sleeping okay?
is your sleeping
Similar.
okay?
Yes,
You are sleeping okay.
Is your
Then
sleeping okay?
you pass in water a lot?
Are you passing?
Passing water a lot.
Are you passing or present
Have you
perfect continuous?
been,
Have you
Have
been
you
passing?
have
Have
you
you
been
been
passing water a lot?
Your period's okay.
Is your period?
Is your periods okay?
Are you
Plural form. Are your periods okay? Mhm.
Are you periods?
Okay. Had any diarrhea?
Did you have any diarrhea?
Did you have?
Have,
Mhm.
have you?
Or have you had
Did you have
any diarrhea?
Had
Mhm.
any diarrhea?
Lost any weight?
Have you?
Have you lost
You know,
any weight? Been living here, been living there long?
have you been here living there long?
Exactly. Have you been living? Great. Well, and okay. Now we are coming to discuss into some social problems. Here on this slide, we can see the pictures that illustrate some social problems. And we should think of these problems just so that people experience living in big cities. In picture A, what does this picture illustrate?
Man is homeless.
Mm.
Streets in the street.
Street sleeping.
Sleeping in the street, in the boxes.
Yeah.
Well, picture B, what kind of problem is there?
Always in social media.
congested road,
Always in
with the more people?
So crowded room because of lack of accommodation. Yes, people. Okay, so picture C.
Smoking in public places.
Which may affect the child.
In front of the child.
Especially in the presence of children. And so picture D.
Eating junk food.
Junk
Food,
food.
junk food.
Junk food.
Other things
Eating
like
too
not
much.
concentrating in the food completely.
Okay, yes.
Eating too much.
Okay, so now let us read some information about social problems. So we speak about social problems because this is very important in the work of doctors. They should be aware of these problems, and so in the text we should make sure that we understand these words. So the first is deprivation. This is the synonym of poverty here. Factors, the synonym is causes, incident, occurrence. Also, we'll meet the word plateau. Plateau means level here in this context. Then pronounced, this is evident. And social classes 1 and 2. So in the classification of the population for research purposes, the 2 highest social classes. So number 1 is a lower class, number 2. And so let us move to the article. So, and let us read the article. Taib Jabbar, are you here?
Yes, ma'am.
Read, please.
The social deprivation is associated with death from all causes. The most pronounced effect is with respiratory and other smoking-related diseases. A similar trend is seen with infant mortality, morbidity from chronic illness, particularly musculoskeletal, cardiovascular and respiratory conditions, and teenage pregnancy.
Do we understand everything here? I mean, mortality, for example. What does it mean?
It's the death rate.
English is death rate.
And morbidity. Morbidity.
Morbidity means genetic diseases.
So the disease rate, yes. So, okay, cardiovascular. What part of the body does it? Is it connected with?
Heart matters.
Yes, and respiratory conditions. Which part?
Lungs.
Okay. So, and the next piece of information is for Hepzibah. Read it, please.
Yes, ma'am. This is not a new problem nor one unique to the UK. It may partly be due to smoking and eating habits, but this disparity was in evidence 80 years ago when those of social classes 1 and 2 were more likely to smoke, eat foods high in saturated fats, and take less exercise. Disparity in health is closely related to income. In the UK, an higher proportion of the population is now living on less than 50% of the average income than 20 years ago. The mortality gap has grown proportionally.
Okay, and here you were right with the arrow which points up. So you said high proportion. Yes, it should start with a vowel, an increased proportion of. Okay. And there is a phrase saturated fats. What kind of what does it mean, saturated fats? Do you know anything about this?
Cheese, ghee, like that.
Compound with the single bonds.
So which is harmful for health, right? Anyway. Okay. So I think are there any other words that are hard to understand here? No. Okay. Now let's look at the next piece of information and let us listen to Ansila. Read it, please.
This has an impact on general practice. There is higher incidence of illness, increased requirement for primary care team. High requirement for primary care team services and the increased use of high use of out of hours and A&E services amongst deprived communities.
Mhm. Well, what about the arrow which is given in the horizontal arrow? So what does it stand for?
Due to higher requirements for the
No, I mean this, the first arrow, horizontal arrow.
Going
Due to, or
Yes,
goes
or
It,
leads to
it's
increased requirements and increased use of out of hours. And these acronym A&D services.
accident and
accident
emergency.
and emergency.
Emergency services. Mhm. Okay. Okay, and let's listen to Asna. Asna, please.
Other factors which have an effect on homelessness, sleeping rough, employment and unemployment, divorce and immigration status, and the adverse effect of living in temporary accommodation are well documented. For example, adults have increasing incidence of depression than people of similar social standing in their own homes.
Mhm. Okay, so this part of the article says why it's important to be aware of these problems because it's connected with the depression and the state of the condition of health. Okay, and mhm. The next piece of information is for Shamisha.
Yes, ma'am.
Read it, please.
Children are less likely to receive their immunization, more likely to have childhood accidents, and have higher incidence of minor and diarrheal diseases. Among those, sleeping rough, poor diet, poor accommodation, and lack of access to medical services are universal problems. A study done in 1986 in London found 1/3 are psychotic, a quarter have severe physical problems, and 2/3 have no contact whatsoever with medical services. Evidence shows that if services are provided, homeless people will use them.
This is a very important piece of information. Well, is everything clear here? Accommodation, what does it mean?
Living
Yes, where people live. Okay. Well, and the next part is for Ramisa.
Yes, ma'am.
Read it, please.
The effects of work have been compared to effects of vitamins. We need a certain amount to be healthy. Then there is a plateau where extra doesn't work and too much is harmful.
It's compared with the vitamins. And okay, good. So we've done this. Now there are some questions just we need to answer. John Parvin, the first question is for you. Read it, please.
What main social factors are given?
What are they? So who can help? What is the list of social factors which are described here? Remember the pictures. Okay.
Homelessness, rough accommodation, smoking.
Okay. Okay. This is
Sleeping issues,
mhm.
diseases,
Lack of accommodation. Yes. Well, yes. The second is for Hala Malik. Number one, read it, please. Hala Malik? Are you here? Hala Malik? Okay. Sultan?
Yes, ma'am.
So read sentence, question number 2, please, Sultan.
Can you give your own reason why those in social classes 1 and 2 were more likely to smoke 80 years ago?
Mhm.
Due to
80 years ago.
addiction,
Mhm. So think about how popular smoking was 80 years ago.
it may be considered as a medicine, ma'am. Earlier times.
So people of with a high income used to smoke a lot.
To show
maybe-
that
Attention.
Yes. Why? What?
to show that their status, ma'am. They have enough money to afford it, so they to
Exactly.
show their
Exactly. That was fashionable. That was like they showed their status. Okay.
luxuriness of
Mhm. Okay. Unfortunately, we have about only 1 minute, and we should just